What is endometriosis? Many women has been facing this condition secretly and don't know what actually causes this condition. Then join me in this video. Endometriosis is a chronic condition where the tissues similar to the lining inside the uterus, that is the endometrium, grows outside the uterus. This can cause pain, inflammation, and formation of scar tissue within the pelvis and other areas of the body. And this can affect your fallopian tubes and tissue lining of the pelvis. So, what are the symptoms? The first one is pelvic pain, pain during intercourse, pain during bowel movement, excessive bleeding during your periods, infertility, fatigue, diarrhea, constipation, bloating, and nausea, particularly during your menstrual period. So, how can this endometriosis affect your fertility? It can change the anatomical structure, that is, the structure of your reproductive organ, due to adhesions and scar tissues. Inflammation, that is inflammatory environments caused by endometriosis, can negatively affect the quality of eggs, sperm, and embryo and disrupt normal fertility. Then hormonal imbalance. Endometriosis can cause hormonal imbalances that can interfere with your ovulation and menstrual cycle, making it difficult for conception to occur. Immune system dysfunction. The response triggered by endometriosis can attack the egg, sperm, and the embryo, leading to complicating process of pregnancy. Then, can women with endometriosis get pregnant? Many women with this condition do become pregnant. It depends on the severity of the condition, and you can use fertility treatments. What are the treatment options available? Medications, use of hormonal treatments like birth control pills, gonadotropin releasing agonist, and the rest of them. You can opt for surgery, that is laparoscopic surgery can remove or reduce endometric lesions and adhesions, which can improve fertility outcomes. Then assisted reproductive technology like intrauterine insemination, then in vitro fertilization IVF can be your result for improving fertility. Lifestyle changes, that is maintaining healthy diet, managing stress and regular exercise can help you improve your overall health and reproductive chances and your chance of conception. How does this endometriosis affect pregnancy? So endometriosis can provide relief from this pregnancy can provide relief from endometriosis symptoms. It can also increase your risk of in complication. When women with endometriosis get pregnant, they are higher with preterm birth, preeclampsia, and miscarriages. Then cesarean section due to complications such as preeclampsia and the rest of them, and poor positioning of the baby due to adhesions in the womb can cause you to go for CS. Can endometriosis be managed during pregnancy? It can be managed with just giving you pain medications that can help you relieve the pains that comes with the pregnancy. What is the long-term outlook for women with endometriosis? It's a chronic condition and can last for a lifetime. So women with it can always go and take medical attention while needed. So it's always crucial you work with your healthcare provider if you think you have this condition, and always follow their advice. Thank you and see you in my next video.